I am Serruya. I am a physician scientist and board certified neurologist here at the Raphael Center for Neurorestoration here at Thomas Jefferson University. We're talking about preventing stroke in people living with diabetes with lifestyle modification. So the main idea here is that the stroke is affecting the brain, and the brain is an organ like any other. So the basic principles that work for all primary care when we're talking about heart health and overall body health, of course, apply to the brain. And in fact, the brain may be even more sensitive to some of these things. That means that the sort of 5 main pillars of brain health are going to be relevant for your overall health and protecting your brain against stroke. And so those 5 pillars are regular aerobic physical exercise, getting out of breath and sweating. And I think it's important to convey to your patients that exercise is not just a lifestyle choice, it's really a medicine. It's just as important as taking a blood pressure pill. And if a person has limitations with their movement, maybe they have diabetic neuropathy and you're worried about a fall, then that's where you can have them go to a physical therapist. But it's really important for the provider, if you put that script to your physical therapy colleague, to say, I really want this person to exercise and push themselves so they can be as healthy as they can be, that they're not so fragile, and empower them with some agency. So that's number 1, is that exercise. Number 2 is healthy nutrition. So the American Heart Association has very specific guidelines about eating more fruits and vegetables, decreasing processed foods, decreasing salt and sugar, and even artificial sweeteners confuse the brain. Things with lots of healthy fruits and vegetables, unprocessed carbs, healthy fish, and usually non-red meat tends to be healthier for the brain. Again, everything has to be in moderation. You have to discuss with your doctor what's best for you, but in general, sort of a well-rounded, healthy meal. And again, that's just as important as any medicine. And when people ask about supplements and things they can take, overall, it's best to do what Mother Nature has. So get your vitamin C, for example, from fruits and vegetables, rather than just taking it as pills. And only use the pills when the doctor, the nurse practitioner says that's really what's indicated. The other items, the next one would be sleep. Sleep hygiene is really important for brain health. You're probably even listening to me now on a screen that's shining in your eyes. This really can confuse the brain if it's done at night when our bodies are just not sort of built to do that. So it's important to tell your patients that if they want to be healthy, they have to have a consistent time to go to bed and wake up, and that they should not use screens in bed, that they should actually avoid any kind of screen in that hour before bedtime and sort of let their body and mind wind down. And that's going to have a healthier sleep, and that's going to be much more restorative, and that has a proven protective effect on the brain. So this is something that doesn't require medicine, but it makes a big difference if a healthcare provider is sort of relaying that to a person is important for their health. Getting exposure to bright light in the day and then having sort of lower light in the evening and maybe sometimes melatonin and chamomile tea. Then the other 2 items of brain health that are really important are simply engaging one's mind, both cognitively, reading books, doing things like that are engaging, and then socially, interacting with other people, even if someone's sort of an introvert. The key here is you don't have to force yourself to do things you're not interested in. So if a person doesn't want to do Sudoku, then they don't have to. It's just do something that they're interested in. In general, it's not great for the brain to do things that are passive. It's always better for the brain to be more engaged and active. So what that means is, if you're going to do something with screens, then make it active, use hearing, listen to a podcast or music. That keeps your imagination going. And if you're going to be using screens, do it in something that's social, something interactive. In general, having good sort of cognitive engagement and social engagement is also really important for brain health. And then the other few points I would just mention real briefly is that it's the various healthcare providers have to be sort of the champion with critical thinking for each patient, and that means really thinking hard about medications. Do we really need to be on all these medicines? Can it be simplified? Because sometimes medicines can help in some ways and then set things back, and we change as time. We're not like clocks, right? Our bodies and our brains evolve over time. So what a person tolerated at one age, they may not tolerate as well. And so we don't want to create more problems for the brain. So it's important to sort of simplify those things and remove what's not necessary. And then depending on the circumstance, just keeping the brain healthy with other approaches like mind-body practice. If there are mental health issues, those are very important to address. We know that unaddressed depression and trauma and anxiety they create a stress state in the brain, and that can predispose someone to heart attacks and strokes and things like that. So anything you can do to sort of help the overall person and make sure those things are addressed appropriately can make a huge difference. The other item just to discuss is one other thing that I also sometimes work with fellow doctors, nurses, and patients and family members is training them on certain mind-body techniques such as clinical hypnosis. Self-hypnosis is a technique that any of us can learn that can help us become healthier. And it's great because it's not like someone is, like, hypnotizing someone else like in a Bugs Bunny cartoon or something silly, but these are sort of techniques that build upon meditation and prayer and breathing and posture and things that we kind of all intuitively know are healthy for us, but does it in sort of a disciplined, structured way to really help us be the healthiest we can be. And this is just an adjunct. We don't expect sort of like magic from saying some particular words, but if we integrate it into all the other things we do in our life, that we care for other people, that we think about ourselves in a self-critical but compassionate way, that we eat healthy and sleep healthy and exercise and all those things together, that if you use some of these tools, it can really amplify that and make you even healthier.